So in this presentation, I'm going to discuss cancer and more specifically lung cancer. So cancer disease is a disease that affects millions of people each year, and nearly all of us will deal with cancer in some form during our lifetime, whether it be directly or indirectly. Um, but I have the question of what exactly is cancer? And so cancer is described as a group of diseases that deal with cellular malfunction. And this occurs due to the damage of a normal cell DNA, and this leads to disordered cell growth and specialization. So I want to discuss some of the differences between a cancer cell and a normal cell. And so um, a normal cell will reproduce roughly about 50 times. It'll go through 50 divisions and then it'll die. Also, normal cells are able to communicate with one another and send signals as to whether they need to reproduce or grow. Um, a normal cell will have adhesive properties, and these are going to help to maintain proper position, and which again aids in the passage of signals between the cells, communication between them. These normal cells will undergo a specialization or differentiation, and these are going to serve a specific physiological purpose. Also, these cells will undergo apoptosis, and this means that they're going to self-destruct or if they become too damaged or diseased. Whereas with a cancer cell, they're not going to reproduce controllably. So they're not going to undergo biological aging, and they'll maintain the ability to replicate and grow throughout their lifetime. These cells aren't able to communicate with one another, so they're not going to they're going to ignore anti-growth signals coming from other cells, and because they lose this adhesion property, they're going to be able to spread throughout other areas of the body. Due to them not being specialized, these cells don't really serve a physiological purpose. And since they don't undergo apoptosis, they're not going to receive the signals reporting the damage or disease that will then signal apoptosis and destroy the cell. So once these cancer cells begin to grow, they can clump together and form tumors. And there's two types of tumors I want to discuss. There's malignant tumors, and then there's also benign tumors. And so the malignant tumors are the ones that are a little bit more dangerous, well, a lot more dangerous. These are the cancerous tumors, and these are going to spread through other parts of the body, and these cells are going to, or these tumors rather, they're going to move through other parts of the body and through the bloodstream, circulatory system, and the lymphatic system. And they're going to invade and disrupt the RNA and DNA of the normal cells, the normal functioning cells. A benign tumor is non-cancerous, and generally they won't come back once they're removed. These cells don't spread to other parts of the body, and the issue with them is that they're going to take up space and they can kind of press on organs or other body parts and create some issues for you. So some of the causes of lung cancer. As everyone knows, smoking tobacco is a huge risk factor for lung cancer, but whether you smoke tobacco or not, you can also, some other environmental factors that can contribute to lung cancer are secondhand smoke, radon gas inhalation, and asbestos exposure. Also, hereditary factors play a large role. It's more likely that you will get lung cancer if your parents had it or a family member had it. And then oncogenes are cells that kind of aid in the in the growth and division and general health of cells, and when they become damaged, they can actually aid cancer cells. So some of the symptoms of lung cancer, these are chronic cough or infections, and these can be bronchitis or pneumonia that just keeps occurring. Also coughing up blood or rust-covered mucus or phlegm, and coupled with chest pain, shortness of breath, or fatigue. And the issue with the symptoms of lung cancer is that generally the symptoms won't present themselves until the cancer is metastasized and kind of moved to other parts of the body, and that's why these symptoms are presenting themselves. So the progression of cancer, it's in 5 different stages. And in stage 0, the cancer has just come about and it's actually located in its place of origin. It hasn't spread at all. Whereas in stage 1, it's a small cancer, it's a small tumor, and it hasn't really grown into other nearby tissues or spread to the lymph nodes. And then when we find in stage 2 and 3 that it's a larger tumor, and the tissue or the tumor is now grown deeply into the nearby tissues, and generally it's spread into the lymph nodes, but however not other parts of the body. When we reach stage 4, that's when the cancer has traveled through the bloodstream, circulatory, or lymph node systems, or lymphatic systems, and it's now spread to other organs, such as the liver, brain, or the heart. So we come to a diagnosis of cancer through several different ways. Image testing. We can find cancer whether it be through X-rays or CT scans of the lungs, and what we're going to look for here is abnormal masses or nodules on the lungs. Also, with the CT scan, we can look for lesions, and these generally aren't found on X-rays. Sputum cytology is just the examination of that phlegm or mucus under a microscope, and we're going to look for cancer properties in there. And then a biopsy is when we're actually going to extract some tissue from the lung, and we're going to examine it for cancer cells. So after the diagnosis of cancer, we're going to move on to treatment. And these are the 4 most popular treatment options when it comes to cancer. So generally, surgery will be performed, and we have 4 different kind of types of surgery. So with a wedge resection, what we're going to do is we're just going to remove the portion of the tissues that are affected by the cancer. With a segmental resection, we'll remove the tissues that are affected and then some surrounding tissues. With a lobectomy, we'll actually remove a whole lobe of the lung. And then pneumonomectomy will actually remove a larger portion or the whole lung. Then with chemotherapy, what we're going to do is we'll use a combination of chemicals, and we'll inject them into the body either intravenously or orally. And what these will do is they're going to kind of target the cancer cells, and they'll try to destroy them. With radiation therapy, we're going to use X-rays to try to pinpoint the cancer cells and try to destroy them that way. And then also there's drug therapy using medications. And it'll generally be a combination of medications, and what they're going to do is they're going to target abnormalities in the cancer cells. So now we'll move on to exercise in cancer and how exercise is beneficial. And so just as with the normal population, exercise is medicine, and it can actually be used as preventative. And so physical activity has been associated with lower levels of cancer deaths. And then during treatment, moderate levels of physical activity have actually been found to really aid people during cancer treatments. And a lot of times their treatments have side effects that that include things such as like fatigue, anxiety or depression, lowered blood cell counts, GI issues, and exercise can actually help with a lot of these, and it can also prevent atrophy, and it can keep and improve your physical abilities that you may have normally lost during cancer treatment. And the American Cancer Society has actually found that people who undergo roughly 30 minutes of like moderate activity every day, such as like a brisk walk, have found a 50% decrease in the reoccurrence of cancer. So for my case study, I examined a 40-year-old male who was recovering from stage 1 cancer. He has a BMI of 26. He is a smoker, so that is a risk factor against him. He lives an active lifestyle. He has an LDL level of 134, an HDL level of 55, triglyceride level of 148, fasting blood glucose of 88. His blood pressure is a little off, but he's all right at 132 over 70. Doesn't have a history of cardiovascular disease or coronary artery disease. His father was diagnosed with lung cancer at age 57, and he's currently undergoing chemotherapy. Because he's undergoing chemotherapy, we'd put him at a high risk, despite not having so many risk factors. And his goals are just to kind of return to an active lifestyle and jog with his dog daily. So for exercise testing, what we're going to do is we're going to give him a physical exam prior to beginning the exercise test. And due to the high-risk nature of the client, we will have a physician present. So for the submaximal cardiovascular test, we'll have him hooked up to a 12-lead EKG, or ECG rather, and the test that we'll use is the modified submaximal Bruce treadmill protocol in order to establish a baseline for his cardiovascular fitness. As for his muscular fitness, we'll use a one rep max bench press, and we'll go from there with him. So for his exercise prescription, we want a prescription that's gonna incorporate his flexibility and aerobic and resistance training, and we'll ideally have this meet 3 to 5 days a week, and his intensity will be submaximal, but we could lower or increase the intensity depending upon how the client is feeling that day, as we want to kind of deal with his chemotherapy treatments. Each session will last roughly 30 to 60 minutes and will focus on improving his all-around fitness levels while having a primary focus on his cardiovascular fitness. So we'll begin each training session with a dynamic stretching, and 3 days a week we'll really focus on his aerobic exercises, and we'll kind of switch them up each day, whether they be walking, biking, or jogging, just so that he doesn't become bored with them. And then 2 days a week we'll focus on resistance training. And in the beginning, what we'll do is we'll use primarily machine weights, and then once he becomes a little bit more comfortable, we'll progress to free weights. And then following every workout, we're going to finish with some static stretching in order to really increase his flexibility. So in conclusion, I hope that everyone was able to see that exercise is a valid type of treatment for cancer when it's combined with these other therapy options, and just how physical activity really plays a large role in the prevention and the management of cancer, and some of the side effects that come from treatments such as chemotherapy, radiation therapy. And hopefully through further research we'll be able to find more benefits of exercise relating to cancer. Thank you.